Hello everyone, myself Dr. Namrata Vichlani. I am practicing as a physician and intensivist in Surat. Today I have recorded this video to give you information about the etiological classification for pulmonary arterial hypertension. So if we find any patient having pulmonary arterial hypertension, our first effort should be to find the possible etiology behind it. We might suspect pulmonary arterial hypertension based on the history, clinical examination, ECG findings, and mostly we confirm it with the echocardiography or other imaging studies. So, what could be the cause for pulmonary arterial hypertension? Broadly, it has been divided into the 5 categories. So, first category is the primary idiopathic pulmonary arterial hypertension or hereditary etiology, or secondary to the collagen vascular diseases, HIV, and congenital heart diseases. So, if any patient falls into this category, the probable etiology might be one of this. Second category is secondary to the heart cardiac diseases, say for the left ventricular systolic dysfunction, diastolic dysfunction, or various valvular diseases. In systolic dysfunction, it might be due to the ischemic heart disease or cardiomyopathies, or in the valvular diseases, it might be due to various etiologies. Say for commonly we see pulmonary arterial hypertension secondary to the rheumatic heart disease, that is the mitral stenosis with MR. So third category is the pulmonary arterial hypertension which is secondary to the lung diseases, say for in patients with the COPD, interstitial lung disease, obstructive sleep apnea. So we collectively call it as a cor pulmonale. Then this respiratory illnesses that lead to the right heart failure. So that is called as the cor pulmonale. Fourth category is the chronic thromboembolic disorders, and the fifth category is the other systemic illnesses, such as in the hematological illnesses. It is common to see in sickle cell disease, it is common to see the chronic pulmonary arterial hypertension, and other miscellaneous etiologies like systemic illness like sarcoidosis or other metabolic etiologies. So when you suspect pulmonary arterial hypertension and confirmed in it with the echocardiography, you need to label the severity, but first you need to rule out the acute etiologies such as acute pulmonary embolism, because it requires the urgent treatment. Our next effort should be to stabilize the patient and to find out the underlying etiology so that we can direct the treatment behind the etiology, and based on the clinical scenario we need to identify the etiology. Say for patient is having any cardiac illness prior, and now he is it is progressing, either the disease is progressing or is untreated and it has landed into the pulmonary arterial hypertension, or with the background of any respiratory illness such as COPD, ILD. If the disease has progressed, it may lead into the pulmonary arterial hypertension. So in that way we need to correlate and manage the patient. Thank you.